Hello everybody, it's me again, just getting ready for work one more time. Today is actually Monday, it's my real day of work, so yesterday went very well, and I was really surprised that I really did very well at work last night. So I'm going to start streamlining these because I watched them and I'm kind of embarrassed, not really embarrassed, but I feel foolish about some of them because I feel like I ramble, so I'm not going to do that. I'm going to try not to, but part of that's my cognitive. I don't know if any of you guys have trouble with that too, but I do. The one thing that I do know is that I enjoy doing my makeup, and so we're just going to do another get ready with me. And today I think what we're going to talk about is therapies. So a while back there was no such thing as therapies because they still didn't even know how it worked, and it wasn't really that long ago. The quickest time frame that in the last maybe 15-20 years they've actually found medications that can suppress the immune system, because with MS what happens is that your immune system gets overactive and it starts to attack itself. And if that's the easiest way to explain it, I'm hoping that's how it works, because that's really what it is it just goes into hyperdrive whoosh, and continues to attack the nervous system, the brain, the optic nerve, anything that it can get a hold of. So it is difficult to, like I said yesterday, it's difficult to diagnose because the symptoms for every person is different. But again, it's where the body actually chooses to bore a hole, for lack of better terms, in whatever it has. So they weren't really sure what they were going to do. And so what finally happened is they found out that what we could do is we could suppress the immune system and get it to a place where we could actually control it or keep it even, instead of going into hyperdrive and then turning around and going nowhere and causing problems with the body that just went up and down. That's why we call it relapsing remissive. So I'm actually considered what they call a remission, just like in cancer they use that in MS as well. Today I got some new makeup, I will tell you that, and I'm very excited to try it. I don't know how well this is going to go, so it might be something that's just kind of small and straight to the point. I don't know if I'll do a lot of my eyes, but I don't want to take too much time. I really would like to see if people would really still like to start sharing these, because I think I've gotten to the point that I'm kind of rambling. Again, today we're going to talk about therapies. I've been on numerous ones. The first one I tried was Avonex, and then I tried the Beta-Seron, the one that was the daily injection, Avonex a weekly injection. Beta-Seron was, Copaxone was a daily shot that you did in your stomach fat or in your hip fat. The Avonex went on top of your thighs. That was a weekly shot. And then once they came out with the first pill, I was so excited. I got really sick and tired of having shots. I did also try the Tecfidera. The Tecfidera was also a pill. And I found that it messed with my blood sugar so bad that that one day I actually passed out within seconds, and I don't really know how that happened, but I almost did a header into my dog crate in my bedroom when I was trying to lay down, and that didn't go well. So I quit taking that right away. The other one I did try, and I've talked to you guys about, is the Tysabri. That was the once a month, going in with the bright yellow form that had the black label that comes with it from the pharmacy, and that scared me, and I was only 35 at the time when I started that. I kind of led the way. Now I'm on, actually, let me go back. Now I'm on Ocrevus, ocrelizumab. I was in the study for it, and I am extremely happy to be part of it now. I was in the study for about 3 years, and I was in the double blind, and then the everybody knows one, and I can't remember what that's called. I can't remember what it's called, but sorry, my nose itches. I knew that I got the drug because my body was failing, and I was failing fast. And like I said, about 10-11 years ago, they told me that I'd have about 2 years to live. And so far, so good. I've already passed them up. And I went on chemo. There was this doctor that worked for St. Joe's or Barrows Neurological, and I was told to actually go there because all of the independent neurologists that I had were just not working for me. So when I first started at Barrows, there were 2 neurologists that I did see. I saw a PA and then I saw another doctor there till they finally gave me to Dr. Vollmer, and Dr. Vollmer actually explained to me, he's the one that told me that I have so much disease that they're not sure that I'm going to make it. So if I continued on that path, if there was no way that they could intercept or do something different, that's what was going to happen. It was really rough. My kids were little, very little, actually probably 12, 13 years ago. But don't ask me about dates because I can't remember ever. So when he told me that, he said that he had just come back, like literally, just come back from Europe. And like 2 days before, I meant literally. And he said that what they were doing is they were doing chemo, low dose chemo. So I've been on Novantrone as well. And they don't really do that. They don't use that anymore at all. They don't do chemo anymore for MS patients. But I will tell you, it saved my life. It did. It saved my life. It was 3 months of a monthly chemo treatment. I also had to have echocardiograms with it because you can only have so much chemo in your life, and because it damages the heart muscle. So I had to have tests before it went in every month for it. I worked through the whole thing. I was actually training someone, and I knew that if I wasn't there, I was going to miss time and she would fall behind in her training, and I didn't want that to happen. So I continued on with work. So after the first month, it was blue. Let's see, I don't even know what color. It looks like blue, like a Pepsi can, and I watched it come down. The first month I did okay. I wasn't sick, or I didn't lose a lot of hair. I definitely, the first month was good. I went right back to work after that. And the second month I also went to work, but I knew that I wasn't feeling really well. It was, I was nauseous and not really sure how to deal with that, but I still went to work because they gave me a bunch of Zofran and stuff that was going to help with the nausea. So the third month, though, kind of took me down like a shot. The last treatment, I lost most of my hair, and I had short hair at the time. It was probably cute, something to this similar, and it was short, and my hair used to be very straight. So short and straight, yeah. And after the third month, I lost about, like I said, 75% of my hair. We had a cat at the time, and I used to think that he was sleeping on my pillow because I'd wake up in the morning and there would be so much hair, and it was just kind of daunting. The best part about it is, though, it came out pretty much the same all over. So they told me that I shouldn't lose my hair at the time, but I did. But when it started to grow back, it grew back curly. So the one lesson that I learned from that is that you got to be careful about what you ask the Lord for, because when I'm a product of the 80s, and when I lived through the 80s, I wanted curly hair. You know how we all did that big curly hair. Everybody wanted it. Everybody needed to have it. So I always used to pray all the time that I could have curly hair because I had straight hair. So you got to be careful about what you ask for, one. For two, you got to be very mindful of the way that the Lord's going to deliver his answer. It might be 30 years from the time that you actually asked for it the first time, but the method can be kind of rough. So I was very sick. I actually was sick for about 2 to 3 days and vomiting. But that really was my last month. But within about the second month, I could actually start to get feeling back in my body, because I had lost all feeling from my breasts down on the bottoms of my arms. I think that's why I still have troubles with that. And I started to feel the bathtub texture. We had a bathtub that had the non-slip bottom, and I finally could feel the bathtub again because I was having trouble feeding myself. I was having trouble bathing myself. My husband at the time, Peter, Kylie's dad, he was having to cut up my food. I couldn't get my fingers together to even pick up a piece of paper. It was really bad. I was not quite so depressed, but I was really frustrated. Even though depression is easy to do when you feel like you are just flat out dying, but I wasn't. And Dr. Vollmer helped me with that. So that really brought back my life. It saved my life, and I will never be unthankful for that. The Avonex, I believe, honestly, if any of you are on the Avonex therapy, I believe personally, and this is again just my personal opinion, the first neurologist that I had, he pushed it on me so fast, and he wanted me to take it within just a couple years of being diagnosed, and that was fine. But the flu-like symptoms and the spasticity it would cause, because it would take 2 days and you got a fever and you got the body aches and stuff, and at night I would actually just curl up and I couldn't control my hands. I was uncontrollable, and then Peter would have to actually force Tylenol down my throat and help me swallow. I really think that's what caused most of the trouble with my MS. I think that was the start of what happened, because it just didn't work for me. I think the flu-like symptoms made everything worse. So today's video, I don't know if I'm just going to sit here and visit, just see what everybody thinks. I want to know what kind of therapies you guys are on, how your reaction to them are, how your body's reacting to them. Like I said, the Avonex for me wasn't the greatest thing ever. I think that's the start of what happened. I think it really did kind of take me down like a shot, and I just kind of really headed downhill from there. The beta-seron I couldn't take, the Copaxone, because what they said were supposed to be little tiny nickel size little welts turned into grapefruit size welts. And so my body just didn't react well to those either. So I'm just a giant conundrum, and I feel really bad because my poor neurologist, he's always trying to find something that's going to work, but it didn't work. Anyway, and so after the numerous ones, the Tecfidera I chose not to stay on, the Tysabri I chose not to stay on, the Copaxone I chose not to stay on, just because of the damage it was doing to my body. Again, this goes back to something similar to with the steroids. What happens with the steroids? Again, the damage to your body versus is it helping? And we have to decide that. The Gilenya I took as well, and actually I loved the Gilenya, but before the Gilenya I started on the Ocrevus study. So, and that was with Barrows, and they did the study, worldwide study, and it ended up being perfect. I had no side effects whatsoever. I had only one exacerbation in 3 years, which the doctors didn't know why, because it was on my left side, and I do need to correct that. I have the lesion in the left side of my brain. That's why I have so much trouble with my right side. So I had trouble with my left side. It was just a one-time anomaly, which was really strange, and I had no other issues while I was on it. So once the study was over, my heart was just broken, because I knew it was going to be a long road before the FDA would get it approved, and I knew that I wanted it. So probably over a year now, almost a year and a half, my stepdaughter Avery, she tagged me in an FDA approval comment about the Ocrevus, ocrelizumab, and it's a 6-month IV therapy that you just go in every 6 months. It's once every 6 months, and you stay with a nurse. She watches you most of the time. You stay for an hour after the infusion, and then you're done. You don't even have to deal with it again. You don't have to think about it. You don't have to worry about it. Then you just need to take care of yourself for the rest of the other 6 months. You do have to watch your vitamin D. I am on vitamin D. That is something that boosts your immune system naturally in a slow motion. So like, we can't have any echinacea or anything like that when it comes to medication, because that actually is like fatal. It like will start an MS attack. The echinacea activates it so fast, it's like having an instant MS attack. So I want people to be cautious about that. Some people might react different, some others don't. So just, again, tell me what you're doing. What type of therapies are you guys on? How are you doing whatever you're doing? How do you like your therapy? What type of side effects do you have, if any? Are you going to continue on that? Are you looking for a new therapy? Just let me know. And you know what? We can talk about it later. So subscribe to my channel. I would really appreciate it. And I hope you all have a wonderful day. See ya.